think the significance of upgrade by WHO to level 6 will mean that increasingly countries can no longer play containment strategy. We are in containment mode. Containment means protect the borders and try to stop spreading. But once it's into level 6, I think more and more countries will have to go into what we call mitigation phase. Mitigation phase means the emphasis will then shift from stopping spreading to looking after patients who are infected. Not much different from traditionally how we deal with seasonal flu. So with seasonal flu, we don't do contact tracing, we don't quarantine healthy contacts, for example. And instead we look for high-risk groups and then pay attention to them. Moreover, under mitigation phase, then most of the patients will no longer be hospitalized. In fact, need to be hospitalized. They need not be hospitalized. But once you have big numbers out there in the community, it is not practical, and from public health point of view, also not necessary. We are actually overdoing it at the containment phase in isolating and hospitalizing many of these patients who actually are quite mild, but purely because we are not sure, and also we wanted to be able to analyze the characteristics of this virus a lot more deeply. So if you send them home, you do not know what possible damage that they may do in terms of control measures. So those are the qualitative change that we must anticipate and that will come about. But we don't have to make this switch from containment to mitigation overnight or suddenly. It will be a very gradual process, may not even be visible